Thank you. Thank you so much. I hope everybody can hear me. What a lovely video. That was really special to watch. Thank you. Right, I'm just going to share my screen now so that you guys can see my presentation. Bear with me. Okay. I'm just going to set this up. All right.
Looks perfect. Thank you.
Is that looking good? Great.
Yeah.
Good. Okay. So welcome, everybody. Thank you for joining me on this lovely sunny morning. Well, actually, it's here in the afternoon in Britain, but I'm really happy to be joining you over in the US in the morning. And we're talking today about hormone health as well as menopausal health, because I know that's a topic that many people are really interested in and inspired by. And I know that it affects so many of us. So I also want to talk to you about food and what we can do to help ourselves to have the most happy hormones. And that lovely introduction video was great. So that covered a lot of this for me. But also just to sort of recap, I am a family physician. I've been doing this for a long time. And I'm really passionate about helping my patients to come to better health. I often think of general practice as a way of saving lives in slow motion and really getting to know people, their families, their extended families, and hopefully checking in on their various health issues rather than just seeing them once and then sending them away. So it really is my passion to be able to come back and see patients time and again and help them through my general practice as well as online. My book was mentioned in the introduction, so thank you so much. This is recently available in the US, so I'm really pleased to be able to share it with you. And hopefully, if you have found this lecture interesting, you may want to jump in and enjoy some of the information in the book. I guarantee that you'll find something in there that you will resonate with. So let's start by talking a little bit about hormones. Now, as you may know, hormones play an integral role in our health. They keep our bodily processes running smoothly, and they communicate vital messages to our body. Unbelievably, there are actually over 50 hormones within us, and they affect every single part of our lives, including our growth, our metabolism, our appetite, puberty, fertility, energy levels. And we can sort of think about our hormones in terms of an orchestra. So if you imagine every individual musician and instrument playing perfectly in harmony, and the conductor, in this analogy, the brain, is doing his job well, then all the hormones are coming in at the right place and working in the right way. You'll have a beautiful symphony. But if the conductor is off, or the bassist is having a bad day, or the violin is screechy, then it can become a cacophony of noise. And even the smallest of imbalances can set this off. So there are quite a few different factors that can affect our hormones, including things like sleep, things that we put in our bodies, things that we put on our skin, even the way we breathe, and different lifestyle factors like exercise as well. And so, hang on, let me just move. Oh, if I can move the slide. There we go. So as I mentioned, you can get a lot of things that can go wrong. And hormones essentially are produced from many different parts of our bodies as well. So the testes will produce sperm and obviously testosterone. The ovaries tend to produce estrogen for the most part. We have the thyroid, we have the adrenal glands, we have the pancreas, and there are many receptors throughout the body for thyroid hormone and for insulin as well. And when we think about hormonal imbalances, we basically start to think about common symptoms of things that can go wrong day to day. So things like weight gain and mood swings, insomnia, fatigue, dry mouth, and so on. And I'd like to share a very brief case study with you that will hopefully help you to understand how important lifestyle changes can be when we try to bring that orchestra of players back into a sense of equilibrium. So I had a patient of mine who came to see me at the age of 58, And she was a new diagnosis of diabetes, unfortunately, but also she had high cholesterol levels, hyperlipidemia. And what we managed to do with a few simple changes to her lifestyle was to not only drop her average blood sugar from 69 to 47 in just 3 months, but also she managed to drop her cholesterol from 8 to 3.5 in just 3 months. Importantly, she was also mentioning hormonal symptoms. She had thyroid imbalances, which we were also able to tackle, as well as symptoms around her menopause, which also improved. So you'll understand that it's not just heart disease, it's not just diabetes that plant-based nutrition can have an impact on, it's also other aspects of our health, including our hormonal health. And amazingly, this lovely lady, even now, 3 years on from this particular case study, is doing really well. And she's managed to maintain her improvements and stay medication free. So I was really, really pleased for her. So as I mentioned, there's lots of different things. So on the left, we have some of the things that you might experience issues with that are related to our hormones that are produced in our bodies. Some of these things you may not have previously thought of. So, for example, many people don't realize that fibroids and endometriosis are actually hormonally driven disorders, which we can come on to in a bit more detail. But also, you might be surprised to know that other things that you wouldn't have related to hormones at all, such as mood changes or things like voice changes or changes to your muscle mass, could also be potentially hormone mediated. So I mentioned that we can do a lot of things to get our orchestra playing in tune. And so on the right, I've listed a few of the things that you might start to think about in your own life. So as you're watching this lecture, you might start to make your own checklists or write notes to think about the things in your own life that you could potentially shift as you're beginning to make changes. So things like minimizing stress, exercising regularly, looking at the medications that you're taking and understanding some of their side effects. Looking at how much alcohol that you drink is another really important one. And getting enough sleep. And of course, we are primarily focusing on food in this lecture. And it's true that without the right nutrients, our body really can struggle to make those correct hormones in the right amounts for optimal health. And on the whole, I would say Western diets lacking in whole nutrient-dense foods do miss out sometimes on the vital building blocks that we need for keeping our hormones in check. But the beautiful thing is, it really doesn't have to be this way. And my plan for this lecture is to go through some of the major conditions in our lives that can be mediated by hormones. And crucially, I will also be sharing how you can start to take back control of this delightful symphony and create the balance for your hormones with the help of your fork. So let's get cracking and talk first about one of the things that every woman will experience when she goes through puberty, and that is periods. Now, interestingly, as the years go by, girls' periods do seem to be starting younger. And why is that? We have more access to nutrition throughout the year, and we're growing taller as well. So it stands to reason that earlier periods are just perhaps another part of this healthy trend, right? Well, not necessarily. You see, when girls begin their periods, our bone growth is essentially finished. And premature puberty is a serious issue because it's linked to greater risks for things like breast cancer and heart disease and diabetes, and even adult onset asthma. And the high-fat, low-fiber Western diet, as well as reduced exercise, actually could potentially advance the onset of puberty for our young women who may not be ready psychologically for the onset of womanhood, let alone all the physical aspects of it. Also, women in the Western world tend to go through menopause perhaps slightly later, which does mean that our lifetime exposure to estrogen is higher, and that could therefore put us at a slightly increased risk of hormone-dependent cancers, according to epidemiological research. So what can we do? Well, it's really about getting that right balance. We do need estrogen very much. And, I can talk in a minute about how important HRT can be for many women. But it's also important to know that we don't need it in excess. And maintaining a normal body weight, moving our bodies, and also making sure that we visit the toilet regularly are all a great start. Now, why do I mention things like sort of being a good weight and going to the toilet? Well, let me explain. It's all to do with estrogen exposures. Being overweight can in itself actually mean that we have a higher hormone exposure. This is because our fat cells are not just globules of lipid, but they're actually mini hormone factories as well. They can make estrogen and testosterone. And this is why polycystic ovaries are linked to being overweight for many women. And another reason why our weight can play a part in our lifetime cancer risk. And it's also why men who are overweight tend to suffer from low testosterone levels and so-called man boobs. And I mentioned going to the toilet regularly. Well, why is that important? Well, it's because being constipated is another way of being overexposed to estrogen. And this is because the body discards excess hormones and products of metabolism through our feces. And when we get bunged up, those waste products seep back into our bodies through the intestinal wall and they get remetabolized. And this actually increases our hormonal exposure. So in helping us to make large and soft stools, a high fiber diet can be really, really useful for hormonal regulation. And lastly, I'd like to touch on pollutants for this part of the presentation. Things like plastics and insecticides can have hormone mimicking effects, and they've been linked to breast and prostate cancer. And in fact, as an example, many studies on phthalates, which are chemicals used to help the durability and flexibility of plastics, show that they can disrupt our hormones. And they've also been linked to developmental issues, fertility problems, obesity. And one study shows us a mechanism by which phthalates induce proliferation and invasiveness of even estrogen receptor negative breast cancers, as well as those of hormone-dependent breast cancers. But it's not just women. Unfortunately, studies have shown that reduced sperm counts, missing testes at birth, which is known as cryptorchidism, testicular tumors, and a problem called hypospadias, which is where the opening of the urethra on the underside of the penis occurs. These have all been potentially associated with phthalate exposures. And the unfortunate thing is that we are exposed to these chemicals without even realizing it, often through all sorts of things. And that list can include things like certain perfumes and makeups, shiny till receipts, microwave meal wrappers and containers, drinks bottles, plastic drinks bottles, deodorants, creams, nail polishes. So there's all sorts of things. And without trying to alarm you, I just think it's important to have some awareness of that, because that really is the first step in noticing how our bodies are affected by our environment. And I recognize that it can feel a bit overwhelming if we think about it a lot, but the great thing is that when awareness can lead to action, we can gradually begin to minimize these exposures from our lives. And it can start small. So if you're somebody that regularly microwaves your food, think about putting your food in ceramic or glass containers first. If you're somebody that drinks a lot of water from plastic bottles, then think about maybe investing in a water filter, or when you're going out for a picnic, make sure that you have a glass bottle so that the water doesn't heat up in plastic and cause you to have higher microplastic exposures. These are hopefully small, easy wins that will reduce your long-term exposures and improve your long-term hormone health. So now I'm going to move on to talk a little bit about the monthly cycle, because although every woman will go through periods, we don't always necessarily know what's going on with our periods. So it's quite handy to have a basic understanding of this. So put simply, our estrogen levels are at our lowest just before and during our monthly period, which you can see here on the graph. The ovaries then release estrogen to reach a peak about 2 weeks later, which stimulates ovulation, which you can see again from the graph. Then the estrogen dips a little and gradually rises again to thicken up the endometrial lining, ready for a pregnancy. But then if the egg is not fertilized, the estrogen then falls rapidly, and then the thickened lining of the womb is lost in the monthly period blood. So you can see there that the cycle of every month is split both into the follicular phase, which is the first 2 weeks, and the luteal phase, which is the second 2 weeks. Now, as that womb lining breaks down, prostaglandins are produced by the endometrial cells, which are the cells that line the womb on the inside. And this causes constriction of the blood vessels and contraction of the womb, which actually causes pain and at times increased bleeding if you have too much of these prostaglandins. They can also cause nausea and vomiting and even diarrhea as they enter the bloodstream and affect the woman who's having a period. Now, period pain shouldn't be underestimated. I remember myself as a teenager really struggling with period pains. And I recently read that actually period pains can even be more painful than a heart attack for some women, based on the levels of prostaglandins in the bloodstream. So just be aware that, if a man and you're watching this and you hadn't realized, period pains can be particularly problematic. And what do we do if our hormones are out of sync? Well, if there's too much estrogen, then the womb lining builds up more than it should. And if there are too many prostaglandins, as I mentioned, then the womb lining is thick, and also the cramping and the pain is worse. Interestingly, that's actually why oral contraceptives help with period pains, because they inhibit prostaglandins by inhibiting the growth of these womb lining cells. Anti-inflammatory painkillers can be helpful as well by, again, reducing the production this time of prostaglandins. But this is also where food can help us as well, because by eating foods rich in whole grains and fiber, fruits and veggies and legumes, we reduce the amount of excess estrogen cycling within our bodies. And also, hopefully, we can reduce the size of our fat cells that make extra estrogens for us. And by eating less foods that stimulate prostaglandins, such as things like processed oils and omega-6 fatty acids, processed meats, dairy products, we may also then see benefits. And in fact, there is an interesting study, which is a crossover study that showed this very well. They did 2 months of a healthy plant-based diet, which reduced the intensity of period pain and the duration of pain as well. So I know that many of you will have people in your life that suffer from period pains who would really want to know this information. The researchers also found that increased sex hormone binding globulin, or SHBG, occurred in the bloodstream, which is really interesting. So the plant-based eaters had more SHBG. Now, what this does is an important type of protein molecule that holds on to hormones and stores them until they're needed. And the reason why this is beneficial is because it reduces your excess hormone exposure. So for context, women who are overweight or who suffer from polycystic ovaries tend to have lower SHBG levels. And so it does have a really important role in regulating hormone expression, as well as obviously the dietary changes that can reduce the amount of excess hormones that we are exposed to. Now, the other interesting thing about this study is that the women also reported increased energy, better digestion, and better sleep. And when the ones who were in the food group were required to ditch their plant-based diet to switch over to the placebo pill supplement group, many women actually refused, despite the conditions of the study, because they wanted to stick to the way of eating that had helped them so much. So I think that was a really interesting finding. Is there anything else that we can do to help with period pains? Well, interestingly, vitamin D. There are actually vitamin D receptors in our wombs. And a double-blind, placebo-controlled trial with a single high-dose vitamin D treatment was shown to reduce period pain. And this is thought to be because vitamin D reduces prostaglandins, which is what I mentioned is made by those endometrial cells, those womb lining cells. So that's an interesting one to keep in mind. I generally recommend vitamin D supplements, whatever your dietary pattern, and especially if you have an indoor lifestyle, and especially if you live in the Northern Hemisphere like I do. Ginger. Now, ginger has been shown in one study to be equally as effective as two different types of anti-inflammatory painkiller. So in one trial, there was 250 milligrams of ginger powder 4 times a day for 3 days. And that was as effective for pain relief for period pains as 250 milligrams of mefenamic acid, which is a common anti-inflammatory pain reliever, for 3 times a day. And also as effective as 400 milligrams of ibuprofen 3 times a day, which is another anti-inflammatory pain relieving drug. Lastly, curcumin from turmeric was also shown to have a potential benefit. Now, the polyphenols are thought to increase BDNF levels, brain-derived neurotropic factor, which improves your period pains, but also is known to help neurons survive and grow, neurons in our brain. A randomized controlled trial used curcumin 2 capsules daily from 7 days before the period versus a placebo pill. And the women did this for 3 period cycles, and they found improved mood, reduced pain, and also, as I mentioned, increased BDNF levels. So I would definitely recommend giving turmeric, ginger, and vitamin D a try if you suffer from heavy periods. So also, I want to touch again on the pill, because that's something that many of you will have tried over the years, and many of you will be familiar with, but perhaps some of you would have questions about. I do think that the oral contraceptive pill has been a lifeline for many women over the years to externally regulate their cycle and also minimize the effects of period pain in order to plan their families. Now, what happens with these is that combined oral contraceptives temporarily suspend the normal symphony between your hypothalamus, which is in your brain, your pituitary gland, which is at the base of the brain, and your ovaries, which are connected to your womb, by essentially drafting in an external band of players, which is essentially estrogen and progesterone that you're given in a pill form rather than producing yourself. So this can improve your period pains a lot, as I mentioned, and it also has the bonus of providing a reliable contraceptive, which can reduce the risk of ovarian cancer, also reduce the risk of uterine cancer, and it reduces the risk of colorectal cancer. But there are also other effects too that it's worth being aware of. So for some women, it can increase the risk of elevated blood pressure. It can cause migraines in some women. It can be associated with gallstones, reduced libido, blood clotting, particularly if a woman is over the age of 35 or a smoker, or she is overweight, or if she has a high blood pressure, which is why it's important to be monitored by your own family physician if you take the oral contraceptive pill. Interestingly, it can also cause potentially increased intestinal permeability and a small amount of nutrient depletion, which many women don't realize. And it can also reduce thyroid hormone usage in the body by increasing thyroid globulin. So in some women, it's great because it relieves cyclical mood swings, but in others, it could potentially amplify anxiety or low mood. In some women, it can improve acne, whereas in others, it can make it worse depending on the formulation that you choose. So you see, external regulation of hormones can have profound effects on the body, some positive and some negative. So what I would say is that one size doesn't fit all, and it really is worth discussing the pros and cons with your own doctor. Let's move on to talk a bit about conditions that we have maybe heard of but don't know everything about, and see if we can find ways where diet can improve some of these conditions. So let's start with polycystic ovaries. Now, these are a really common cause of fertility difficulties in women, and PCOS, polycystic ovarian syndrome, is associated with less frequent ovulation and erratic periods. So your periods may be less regular than once a month, because you're ovulating less, you're producing less than 1 egg a month from your ovaries. It is also associated with weight gain and acne. And this is primarily because it's a condition fueled by insulin resistance, which is similar to type 2 diabetes. It's a multi-systems issue And that insulin resistance can be one of the main drivers then for your issues with irregular periods. Now, what's interesting is that a high fiber diet can reduce your risk of side effects with PCOS. So if you reduce your high glycemic index foods, so reducing things like white flour, added sugars, and fizzy sugary drinks, then this will help to improve your insulin sensitivity. Exercising as well is very helpful, and reduced consumption of saturated fats and animal proteins is helpful as well. Women who have polycystic ovaries tend to have more receptors in their body for AGEs. Now, hopefully some of you might have read or learned from previous lectures what AGEs are. AGEs stand for advanced glycation end products, and they're proteins that have a sugar attached to them, and they're biomarkers that are associated with aging. So just remember it, that AGEs cause aging. But they are also present in meat and cheese and fried eggs, butter and cream, and fried and heavily processed foods, essentially junk foods. And when meat is cooked, it releases more AGEs, advanced glycation end products. And that is especially true for barbecued meats. So these foods are essentially going to be minimized if we want to reduce the oxidative stress caused by advanced glycation end products. Soy foods like tofu have been shown to improve polycystic ovarian syndrome. And one trial from 2018 compared a standard diet using animal protein versus soy protein, where the women were given the same amount of macronutrients. So the same amount of calories, the same amount of protein, the same amount of carbohydrates, and the same amount of fat. And what happened? The soy group had significantly reduced body weight, reduced waist circumference. They had reduced levels of insulin hormones, reduced levels of insulin resistant, and also reduced blood sugars and triglyceride fats in the body. So there was a number of very important health benefits associated with consuming soy protein instead of animal protein in the women that were in this trial. So let's move on and talk about another condition, which is hormonally mediated, called endometriosis. Hopefully some of you have heard of endometriosis, because it's actually a really serious condition and many women don't realize that they have it. Now, what happens with endometriosis is that the tissue that lines the womb each month, that endometrial lining that we talked about earlier, can grow and bleed in other parts of the pelvis. So with endometriosis, this endometrial lining can actually be found in all sorts of places, even in the lungs and very rarely the brain, but most commonly it's found just within the pelvis. The problem that women face is that when they have their monthly period, that monthly bleeding can happen outside of the womb and in the pelvis elsewhere. As you can see from this image, if the bleeding happens outside the womb, it can irritate and inflame that tissue, causing the potential for severe period pain. It can even cause bowel loops to stick together. It can cause reduced fertility, and it can cause sort of painful sex as well. It can even result in the need for removal of some of the affected areas, or even in severe cases, a hysterectomy. So this is important because many women think, oh, I've just got period pain. Or even when they go to the doctor thinks, oh, it's just period pain. But if you're having extreme pain, painful sex, you're having nausea, you're having to take several days off work each month, then you really need to consider whether a diagnosis of endometriosis might be possible. Now, diagnosis, as I mentioned, can be difficult because essentially most people wait, or they sort of maybe go to the doctor and the doctor doesn't realize. And it takes on average 8 years for a woman with endometriosis to get her diagnosis. The best way of diagnosing it is through a laparoscopy, where you put a camera into the pelvis to look for some of these endometrial deposits. So why does it happen? Well, it is a disorder that is linked to estrogen excess, but we don't really know why it happens. So, how do we help reduce endometriosis and its effects? Well, given that it's a diagnosis linked to excess estrogen, and as we discussed earlier, for period pain in general, a healthy plant-based diet may help. One study looked at the link between the consumption of red meat and chicken and the development of endometriosis. The women were followed up for 20 years and had their endometriosis confirmed by laparoscopy. This was really interesting, actually, because the effect of red meat was independent of the saturated fat that the women ate. And the researchers wondered whether heme iron could have played a part in that link. Also, exposures to phthalates is another important issue. It may be linked to endometriosis as well. And interestingly, foods containing phthalates, remember what I said about phthalates? They are contained within many types of plastic to help the durability and flexibility of the plastic. But exposure to phthalates may be most commonly found actually in fish from UK data and in chicken from US data. So with the consumption of fish and chicken, we may also be consuming phthalates, which could potentially increase our risk of other issues such as endometriosis. What about fibroids? Let's move on to fibroids, which is another sort of hormone-dependent condition that many women experience. So with fibroids, you have an internal muscle layer within the womb, which can then grow to form a lump, or we would call it a fibroid tumor. It's not the same as a cancer. So it doesn't cause a spread anywhere else in the body, and it shouldn't cause any other side effects. Now, the risk of fibroids increases with increasing estrogen exposures. Now, interestingly, having our periods starting younger than 11 years of age can increase the risk. And this is also why fibroids tend to reduce or shrink in size after the menopause. But you might not want to wait that long. So, what do we need to know to help ourselves as well as seeing the doctor? Well, that there is a correlation between exposure to endocrine disruptors within our fat cells and increased fibroid risk. So it's those pesky plastics again. Losing weight also can help by reducing the size of the fat cells that store these compounds, as well as by reducing the amount of estrogen made by fat storage cells. Fibroid lumps are associated with beef and ham consumption. One study showed green vegetables and citrus fruits are thought to be protective. Now, we only have observational studies at this point, and I do think really that more research should be done. But from what has been shown so far, drinking alcohol has also been linked to fibroids, as well as stress and reduced physical activity. So when we think about the changes that we want to make to our own lifestyles, we think about getting a bit more movement in our day, drinking less alcohol, limiting beef and ham consumption, and maximizing veggies and citrus fruits consumption as ways to help ourselves as well. Now, I do want to touch on fertility, because this is an important part of our hormonal symphony. And also because the stress of being unable to have a baby when you desperately want to is one of life's greatest griefs. So I thought I would just do that a little bit of justice by mentioning it here. I know it's not part of the talk, but it is hormonally mediated in some people. And as I mentioned, there's lots of reasons why pregnancy can be hard to achieve. But for some couples, PCOS or fibroids or endometriosis can play a part in not being able to conceive. Also, stress can play a big part. So I do love to make a real emphasis with my patients on how important it is to seek meaning and joy and love from other things in your lives whilst you're on a fertility journey. I've actually seen countless couples give up on having a baby after failed fertility treatments, only to then fall pregnant when they least expected it. And I'm thinking that perhaps that's because the tension around creating life has gone and the joy of sex has returned. But I thought it was worth mentioning here in this section that Maintaining a healthy weight can be important for fertility. Being overweight can stimulate some of these issues that we've talked about, and increase the risk of things like PCOS or fibroids. But also, I want to mention being too slim can mean that your body cannot sustain the marathon of a pregnancy and childbirth. And your periods can be disrupted if you're not meeting your body's energy needs, or if you're over exercising. So, many people who are enjoying a whole foods plant-based diet, they want to be super healthy, but they may be, in some cases, finding that their periods are becoming less regular. And they need to really look at that and say, okay, something's going on with my hormone balance here. It may be that I actually need to reduce the amount of exercising that I do, or actually I need to increase the amount of healthy fats that I'm consuming. So it's not just advice for people to lose weight. Some people may need to gain weight. So it's important just to look at your own individual needs around this and see where you might need to put your focus. Right, let's have a look. The next thing I wanted to touch on is sperm counts. Now, I'm sure it's probably mostly women who are interested to join me for this lecture, but there may be some men amongst you who would be interested to know a bit more about how to maintain your sperm counts. Now, if you have been diagnosed with a low sperm count, your doctor will advise you on the severity or whether fertility treatments might be needed. But I thought it would be worth adding a small section here on things that you can do yourself to maximize your sperm count. Now, vigorous exercise helps fertility for men and for women, so long as they maintain a healthy weight. So avoiding excess heat to the testicles is important, though. So think about if you're a cyclist or if you like to have very hot baths, reducing those may help your sperm to survive. Limiting your exposure to hormone disrupting chemicals will be beneficial. Dioxins and heavy metals, especially concentrated in plastic heated foods, farmed fish, and processed meats, have been associated with reduced sperm quality and increased length of time to conceive. What can we do to optimize that? Well, vitamin E is helpful. Selenium is helpful, which you can get from Brazil nuts, just 1 or 2 a day. And coenzyme Q10 is also helpful for healthy sperm. And you can get these from nuts and seeds. A few studies have shown that an association with reduced sperm count has also been with saturated fat in the diet. So cutting back on meat and dairy, if you're a big lover of steak and cheese, may help your sperm swim to their best. Boosting vitamin D might be important because several studies have linked higher vitamin D levels with improved sperm. And there is lastly some anecdotal evidence that fenugreek might be helpful as well. So it may be worth giving that a try. So let's talk a little bit about menopause. Before we do, I'm going to take a little sip on my drink. So I'm getting a little bit of a scratch in my throat. I hope you're all still with me and enjoying the talk. So menopause, this is a big topic. And it's something that many women can sail through with no symptoms. But actually, menopause can be a very real trauma for some women, especially for those who've had to experience a surgical menopause because of a hysterectomy operation for whatever reason. So it is important to recognize that it can be really vastly different from one woman to another. And there are lots of symptoms that people don't often realize. So, for example, 30% of women will have bone pains and body aches when they go through menopause, but they may never have associated it with menopause. People usually know about hot flushes, but it can also be associated with insomnia and sexual dysfunction, some vaginal dryness, but also vaginal atrophy, which is, again, something that's not really talked about, but can be exquisitely painful. And it's usually associated with vaginal dryness, but it can cause a severe itching and discomfort in the vaginal area to the point for some women where they are unable to have sex, or they can't sometimes even sit down because of the irritation that is causing them. So this is something that it is really important to be aware of, because there are treatments available for this. What else can happen? Mood changes can happen as well. And you can have issues with hair thinning. You can get issues with incontinence or urgency from the bladder. Our bone health can be affected. So we can have increased risk of fragility, fractures, and loss of bone mineral density. And it's natural, in fact, for many women to experience some redistribution of their weight. Because as I mentioned before, as the ovaries are producing less estrogen, the body likes to maintain balance. And the body knows that fat cells can also produce estrogen. So it's actually really common for women to then have a redistribution of fat, to have more visceral fat or belly fat, to help to maintain that equilibrium of estrogen exposures. And in fact, in the Western world, about 65% of postmenopausal women will experience being overweight. And that's partly why. Now, should we have to accept these changes quietly? Well, I don't think that we should. There are many ways to deal with these unpleasant symptoms. And your doctor will be able to talk you through the medical treatments available, including the use of hormone replacement therapy if you should choose to try it. I want to let you know that in terms of bone mineral density, in the UK, it's actually HRT is actually the primary way that we can help women to reduce their bone mineral density loss during menopause. And so it's definitely worth looking into. If you are an eligible candidate for HRT, it may improve your risk of reducing your bone mineral density as you go through menopause. Can diet and lifestyle make a difference? Well, yes, I believe it really can. But let me just kind of go through a little bit more about what you might expect. Now, in the years coming up to menopause, you might be surprised to find that you actually have more frequent periods and then they become heavier. And this is because as the ovaries start to run out of eggs, our hormone levels can start to go a bit crazy. They don't just drop. They can actually rise dramatically as your body is trying to stimulate your ovaries to produce more estrogen. But eventually they do become more sporadic and eventually they stop. And the diagnosis of menopause is usually a year after your last period. So I guess what I'd like to say is that it's worth also giving yourself a fresh perspective on some of these changes. Because I don't want you to think that having a menopause is the end of your joie de vivre or that everything is downhill from there. Because actually, I think that menopause can bring great gifts with it. Now, there's actually, I think I've mentioned this once before, but there are only 3 mammals that experience menopause. Humans are obviously one of those mammals, but the other 2 might surprise you. Many people guess that it's chimpanzees or apes that experience menopause, but actually it's pilot whales and orcas. And the reason I think that menopause is so important is because it allows the female of the species a way to maintain their importance and contribution to society after their reproductive years. And this is actually a huge gift. Now, remember, with pilot whales and with orcas, it's often the mother or the grandmother that leads the pod. And I think that we perhaps have it wrong in Western society because it seems that biologically we're designed to be a matriarchal society. We're designed for women to play an integral role in the continuation of our community links and life and looking after grandchildren and the young people of the community, and that we actually have a lot of advantages in being able to maintain healthy lives after we're able to give birth. So also, actually, social context is quite important when we deal with the menopausal transition. So there was a study in 2007 in Ecuador that showed middle-aged women there felt that they gained in both maturity and confidence when they went through menopause. And again, interviews of women in Jordan back in 2008 showed that menopause was actually a positive transition for them and a route to wise old age. Interestingly, with the Hadza tribe in Tanzania, they really sort of emphasize the grandmother hypothesis in action, because the elder females of the tribes would be foraging, giving away food, offering childcare, and were actually, and still are, vital and a respected part of the tribe. So I think it's a great idea if we can aim to reframe menopause, not just the women going through it, but for the whole of society, in order to support women who are experiencing symptoms, but also to uplift women so that they feel more valued in society and that they can bring so much more than just the ability to reproduce. Also, it can be perhaps a new dawn where you don't have to worry about periods or fibroids or endometriosis or childbearing or breastfeeding. So my hope is that as a society, we can begin to revere and respect the matriarch for her wisdom and her longevity and her valuable contribution to our lives. I don't know what you think. I hope that you agree. Let's talk a bit about making the most of this important transition. So I think we can look for inspiration in the medical literature. There was an interesting series of interviews conducted by an anthropologist called Margaret McGill of women in the US, in Canada, and Japan. And what she noticed was that women in Japan tend not to have hot flushes to the same extent as American women, or indeed have a word for the phenomenon. And the only symptoms that they mentioned, other than the cessation of periods, was shoulder stiffness. And men reported this symptom about as often as the women did. Why? Well, apparently the women were not more shy about reporting symptoms, according to her research. So could it be their food? Well, the traditional Japanese diet is based on rice with relatively little meat and no dairy. So it could be the fact that avoiding dairy hormones might have played a part. Japanese women were also seen to be slimmer on average, meaning that the estrogenic effect of excess fat cells was minimized. But also Japanese women tend to eat a lot of soy in the form of miso soup and tofu, and tempeh, edamame beans. And I mentioned before, soy is a really important protein for period pains, as we discussed, but also it is a complete source of amino acids and phytoestrogens. Now, the isoflavones or phytoestrogens contained in soy, specifically genistein, have been shown in studies to improve menopausal symptoms. They've also been shown to improve bone mineral density and reduce the risk of breast cancer, prostate cancer, and colon cancers. So it's not just women who benefit. One study followed Japanese women over time, and those who ate more soy were 68% less likely to experience hot flushes, or hot flashes, as you call them, than those who did not. Various studies do have mixed results, and it's likely that overall there is a definite benefit for most women. But interestingly, our microbiome can play a part in whether we respond to the genistein within soy, whether we can hopefully get those benefits. So again, it's about increasing fiber-rich foods to help support a thriving microbiome. What about hormone? What about herbal remedies, not hormone remedies, herbal remedies? Well, they can be, I would say, a lifeline for a lot of women, but the results are mixed. So I would advise you that if you do try a herbal remedy, it can really be a trial and error approach. Herbs with anecdotal evidence of benefits with this menopausal transition would include things like black cohosh, red clover, ginseng, ashwagandha, which is an adaptogenic Indian Ayurvedic herb, and sage leaf as well. I do want to give you a note of caution, because the supplement industry is generally not well regulated. So unless your remedy has traditional herbal registration or a similar sort of third-party testing perhaps on their website, it's going to be hard to know the concentrations and active ingredients that you're consuming. So do let your doctor know as well if you're trying something, in case it interferes with another medication that you're taking, which happens with a few different things, especially things like St. John's wort that many people use for depression. Now, I did mention just now the importance of soy, but I thought it's worth just diving into that a little bit more because of its huge benefits for hormone regulation, because it's also generally feared. A lot of people really fear soy. And I'm wondering whether that's partly because of the use of soy to feed cattle for us to then eat their meat. And those soy that are grown for that purpose may be genetically modified. Or maybe it's because the name phytoestrogens causes fear of excess estrogen exposure, which perhaps would understandably lead people to think that soy products have feminizing effects. But the literature could not be further from that position. In fact, what we know from studying this is that soy is a really misunderstood bean, and it's a fabulous source of protein. It's actually a selective estrogen receptor modulator, a SERM. In other words, it acts like a weak estrogen where it's needed and an estrogen blocker where it's not needed. So, you see estrogen receptors are actually on a lot of tissues, and there are alpha and beta versions of these receptors. And so when soy isoflavones bind to these receptors, they tend to favor the beta receptors. And this does have a protective effect and improving cardiovascular health and bone strength, which is essentially acting like a very weak estrogen, whilst also reducing breast and endometrial cancer risk, which acts like a weak estrogen blocker. So this is why I think there is that confusion. It has beneficial effects on sort of both the blocking of estrogen effects on the one hand and the potentiation of estrogen effects on the other. So there's an interesting study that took 3 cohorts of women who were menopausal and followed them for 2 years. Their bone mineral density was monitored, which helps us to estimate their risk of hip fractures and osteoporosis as they get older. So the control group of the 3 arms basically had a decline in bone mineral density over the time of the study, as you might expect, because, as I mentioned before, bone mineral density can drop quite precipitously at menopause. We lose about 1% of our bone mineral density a year after the age of 40. And then when we go through menopause, it can be up to about 20% of loss of bone mineral density in the 5 to 7 years after menopause. So there really is a significant change there, which is why this conversation is so important. And again, why you might want to consider looking into hormone replacement therapy if you are suitable for it. But what happened with this study? Well, as I mentioned, the control group lost their bone mineral density slightly, as you would expect. The women who were given a progesterone hormone cream to use had less of a reduction in bone mineral density, which is great. But the women who were asked to drink just 2 cups of soy milk a day actually had an increase in their bone mineral density over the 2 years of the study. So this is, again, a living example of how you can utilize the power of a simple bean to actually improve your bone strength going through menopause. I do think, again, that more research is needed, but this does serve as a great example of how misunderstood the soybean has been over the years. And if you've been worried about man boobs, then this is an absolute myth. And in fact, if you were really worried about man boobs, it's probably best to avoid drinking dairy because that has bioequivalent estrogen within it. And the strongest phytoestrogen that you can find is actually in hops, which is why if you drink a lot of beer, you may also be potentially vulnerable to man boobs if you're a man. So so that's hopefully going to be clearing up some issues that you would have over soy products. Now, I'd like to have a quick discussion with you about hormone replacement therapy. Please do discuss this with your doctor. For anyone that has had to deal with premature menopause or surgical menopause, HRT is an absolute lifesaver. But I also want to just make you aware that a recent Lancet analysis, which brought together evidence from around the world, suggested that for women of average weight, 5 years of hormone replacement therapy from the age of 50 would actually only increase breast cancer cases by about 1 in 50 women using combined estrogen and progestogen, and about 1 in 200 women with estrogen-only preparations. Now, these figures do double after 10 years, but it should also be clear that this 2% figure, this 2% risk, is actually very small compared to the increased risk of breast cancer from obesity, from regular alcohol consumption, and also from lack of physical activity. For example, when you're postmenopausal, your risk of breast cancer can increase by about between 20 and 40% with obesity compared to average weight. And just 3 alcoholic drinks a week can increase your risk by about 15% compared to women who are teetotal. So I think it's worth just giving you these figures so you can actually aim to arm yourself with information that will help you decide whether HRT might be right for you. Body identical HRT is something that your doctor should be able to talk to you about, which has fewer side effects and risks. You can also get HRT in the form of patches and gels rather than tablets, which are useful because you don't have to metabolize them through your gastrointestinal tract. And I also want to draw your attention to the fact that the gold standard of hormone replacement therapy, which is an estrogen gel or a patch with a micronized progesterone in tablet form, this actually does not increase your risk of breast cancer within 5 years of taking it, according to a 2018 systematic review. So I'd really like to just highlight that for you, because understandably, many women have been very reluctant to even consider HRT because of the fear around that increased risk of breast cancer. And I think the main reason for that was the Women's Health Initiative study from 2002 and the Million Women study from 2003. And what happened with those is that with the Women's Health Initiative study, it was a US study, and it was stopped because there was a concern due to the increased risk of breast cancer, heart disease, strokes, and blood clots that was reported in the combined hormone replacement arm of the study. However, Professor Langer, one of the principal investigators of the study, wrote a paper saying that when the initial results were assessed, most of the participating investigators were excluded and had not approved it. And he also said that the headline of the study was irresponsible and factually incorrect. The reason for this confusion, I think, is that the average age of the participants in the study was actually 63, which is more than 10 years beyond the menopause. And that's quite different from women who might be sort of undergoing hormone replacement therapy from the age of 45 up to 50 and 55, because maintaining levels of estrogen at menopause is different from reintroducing it 10 to 15 years later. There are many women there that had already developed the risk factors for heart disease before they started on the HRT. And when you look at the data, it was actually true to say that there was not really a statistically significant risk of breast cancer. But because of this study, the number of women taking HRT dropped by about 66%. And this is basically an entire generation of women that were sort of scared into stopping their HRT, and then had to endure things like hot flushes again, bone deterioration, memory loss, vaginal dryness, hair loss, aches and pains. And it also stifled new research because women were too scared to take it and physicians were too scared to prescribe it. So I do think, again, that it's worth mentioning HRT is one of the most appropriate treatments for symptomatic women within 10 years of menopause without clear contraindications. Now, it's not going to be suitable for everybody, especially if you have a history of breast cancer. So it's worth discussing that with your doctor if you're interested. But also, it's worth highlighting here that there is, in fact, a potential risk from not taking HRT. There was a BMJ study from 2012 that followed a large group of women taking HRT for 10 years that began soon after menopause, which is when you're supposed to start it. And what they found is that these women actually had a reduced risk of mortality, reduced risk of heart failure and heart attacks, with no increased risk of cancer, blood clots, or stroke. So that's just something to think about if you have been scared of the prospect of HRT, but curious about trying it. Then hopefully this education may be interesting to you, and you may want to discuss it further with your own doctor. I'd like to share now a little case study. My patient, Michelle. Now, she is a lovely lady, and she is a real example of the power of plants for improving health around the menopause. Now, what happened with her is that she came to see me, and she was pretty desperate. She came in tearful. She was getting severe period cramps, hot flashes, and frequent episodes of anxiety. She was tired all the time, and she'd regularly wake in the early hours of the morning in a panic. And she would describe it as 2 weeks of hell every single month, in which the cramps were unbearable and she was having breast tenderness. She said that she was not a medication person, and she admitted to me that she was not likely to take any treatments. We'd done standard blood tests to rule out things like thyroid imbalances. And I told her that I thought she was perimenopausal. So she was around the menopause when all of these wild swings in estrogen were beginning to take place for her. She was still in this sort of limbo land of having periods that were heavy and painful, but also experiencing the crippling symptoms of menopause. She was not depressed. She wasn't lacking in purpose. There were no major stresses in her life. So I decided to talk to her about simple lifestyle measures that could improve her symptoms. And I briefly explained to her that a whole foods plant-based eating pattern may help her. And she was initially quite skeptical. She told me that she was already healthy. She didn't really see how it could help. And she really felt like she'd tried everything. Now, I understand this because I have a lot of patients that feel the same. And I said to her, I understand that you might be feeling this way, but here are some resources. And if you want to try it, you can. Unbeknownst to me, she had decided to go and buy a plant-based cookbook and conducted her own online research after our discussion. And she decided that she would, in fact, start to introduce tofu or edamame beans every single day, as I had suggested, that might help her with her flushes. She cooked all the recipes, and then she noticed her mood swings begin to subside. Her periods got lighter. She began to experience a better sleep at night. She wasn't getting period cramps anymore, and her anxiety had also improved. So she came in to see me about 10, 11 months later, and she looked like a different person. She came in smiling, and she said that she feels as though she looks younger. She said the bagginess around her eyes had disappeared. She said she'd lost about 9 pounds in weight. She hadn't been trying, but she just felt a lot more vibrant. She felt a lot more energetic. She wasn't getting any bloating anymore. And she was confident. She was happy. And I felt that she was truly vibrant. And I love to share her story because this really does show the power of plants to improve so many aspects of our health that we may not have otherwise realized. And she also taught me a really valuable lesson that you should never lose hope that you could feel better than you currently do. And in this case, obviously, plant-based eating was just the change in perspective that she needed. And I thought this was a lovely way to round off our menopausal section of the talk, to give you a feel for what you could hopefully achieve in your own life moving forward. So now we're going to go briefly on to the thyroid, because I think a hormonal health talk is incomplete without a little bit of a touch on the thyroid gland. Now, when your thyroid stops working, you can develop hypothyroidism, which is usually treated with thyroid hormone supplements. But if your body creates antibodies against the thyroid, then you can also develop something called thyroiditis, which is a form of inflammation. And it's often called Hashimoto's, again, which results in imbalances to the metabolism and the way your body's functioning. So if your thyroid is overactive, you might have anxiety or excess heat or a rapid pulse. And too low in function, you might feel cold, you might be gaining weight, you might have some dry skin. And these are all examples of potential symptoms. And what you might notice with your doctor is that when your thyroid is not making enough thyroid hormone, then your thyroid stimulating hormone level rises. And this is the pituitary gland in the brain trying to stimulate the thyroid to make more hormone. And what's one of the main reasons for thyroid dysfunction around the world? Well, I think my slide kind of gives it away. It's iodine deficiency. So iodine is crucial for thyroid function, but many soils are depleted from this vital mineral. For example, in some places of the world, a potato would contain plenty of iodine, but in others, if the soil is not great quality, there are going to be negligible amounts of iodine within that potato. So in the US, your salt is iodized, which does make deficiency a bit more rare. That's not the case in the UK. We tend to get iodine from cow's milk, which is used in the sanitization of milk storage units, and therefore it's given to the feed of the cows as well that provide milk. But what I would say is, for those of you who are hoping to improve your blood pressure, you don't necessarily want to be having a lot of salt in your meals. So I would suggest perhaps going for low salt options, which I think are still fortified with iodine. And also in the UK, we have many fortified plant milks that now contain iodine, which may also be true in the US. So make sure that you look at the side of the packet if you're buying a plant milk to see if it is fortified with iodine. Seaweed is another great natural source of iodine. In fact, I like to think of seaweed as sea plants because they provide us with some vital nutrients, and we don't like to think of weeds. I do think that they deserve our respect because sea plants are a sustainable and healthy way to get a lot of different nutrients that we might miss out on. Now that we're living with the consequences of overfishing and industrial toxin exposures in our oceans. And in fact, a typical sheet of dried nori that you might use for making sushi, or also just quite tasty as a snack in itself, contains about 40 micrograms of iodine. Now, remember, you shouldn't have too much iodine, just as you shouldn't have too little, just like Goldilocks. You don't want to have too much, which is why I would advise you not to consume kelp, or at least if you do, to be mindful that the amounts of iodine within it can vary quite wildly, and it can sometimes be very high in iodine. If you decide to make life simple and you're not sure where you're going to get your iodine from, you could take a non-seaweed or a non-sea plant iodine supplement. And I would go for one that contains no more than around 150 micrograms in the form of potassium iodide or potassium iodate. Another great mineral for thyroid function is selenium. Now, we do need iodine and selenium working together in that hormonal symphony to keep the thyroid happy. Now, what happens with selenium is it helps to protect the thyroid from oxidative stress by making an antioxidant called glutathione. And also selenium helps to activate thyroid hormone, converting T4 to T3 within the body. Now, as I mentioned earlier on in the talk, when we were talking about sperm health, you can find selenium in Brazil nuts. You don't need many, just one or two, but you can also find it in brown rice and whole grain spaghetti, pasta, beans, and seeds as well. Zinc helps to stimulate the production of thyroid hormone as well. And zinc can be found in seeds and nuts and beans and tofu, whole grains like brown rice. And to boost your uptake of zinc further, you can actually ferment these foods. So you can sprout or soak your beans to increase the amount of zinc that you that you absorb. Garlic can be added to your meals and, for example, to hummus or to rice, or to also boost your absorption of zinc. Now, when it comes to thyroid health in general, there's not much data on the specific benefits of a plant-based diet for thyroid function. Some epidemiological data does suggest that plant-based diets are associated with lower rates of hypothyroidism. And other research shows us how beneficial plant-based diets can be for generally reducing the risk of autoimmune diseases. What is absolutely clear, though, is that iodine levels must be adequate, or else the whole sort of hormone harmony will be off balance. And the body is therefore more susceptible to the effects of iodine blocking foods like soy and cruciferous vegetables. So just be aware that a lot of the healthy foods that you'll enjoy may reduce the amount of iodine that you absorb. Cooking can sort of deactivate the enzymes needed for this, but crucially, ensuring that you have enough iodine in your diet will be the most important thing you can do to ensure that you can use all of these plant compounds in the healthiest way. Yes, I forgot to mention, make sure that you aim to eat all the vitamin-rich foods. So a multitude of fruits and veggies will give you plenty of things like vitamin C and beta-carotene for vitamin A, vitamin B2, B3, B6. And it's all of these things in combination with appropriate levels of iron, zinc, selenium, and iodine that will help your thyroid to function well. Right. So I'd like to just do a bit of a summary of some of the things that you can start to do in your day-to-day that will improve your hormone health. And this is stuff that we have already covered, but it's nice to have a summary slide for you guys to use or take notes from. I would say definitely cut back on processed foods. They tend to have higher levels of unhealthy fats and other exposures, not great for hormone health, as we've talked about. Eating more plant-based foods is wonderful. So you've got plenty of fiber to boost your hormonal regulation. Fermented foods to help feed your gut buddies, your microbiome, things like miso, sauerkraut, tempeh, and also to help your absorption of other nutrients. Minimally processed soy products daily are great, especially if you're menopausal. But I would say just if you have a thyroid imbalance, to be careful that you're having enough iodine and selenium so that you ensure that you're getting all the things that you need. Perhaps eating a handful of nuts a day and avocados for healthy fats is going to be really helpful. And sprinkling a tablespoon or 2 tablespoons of ground flax seeds on your food each day for healthy omega-3 fatty acids. They can go in smoothies or curries or in your baking or mixed in with your yogurts. You can get great coconut yogurts. I don't know if they're available in the US, but certainly in the UK, there are some lovely coconut yogurts that have probiotics within them as well. Move your body. Remember that your lymphatic system relies on your body moving to get your lymph around the body, which is important because that is how your immune cells are also able to transport around the body. So remember to take that walk or go to the gym or do whatever you need to do at home to move your body and have fun. I also, again, just want to touch on minimizing plastics within our diet and within our lifestyle in general, again, to help improve that hormonal symphony. Now, we touched on some herbs that would be helpful for menopause, but I'd say generally using herbs and spices is really helpful for all sorts of reasons. Turmeric and ginger I've mentioned for period pains, but also things like sage and parsley and mint and cardamom. They're all packed full of antioxidants and polyphenols. And herbal teas are your friend as well. A lovely way of getting more antioxidants whilst also curbing your appetite if you get the evening munchies, which many of us do. Eating tryptophan-rich foods is great for our mental health. Pumpkin seeds and butternut squash, for example. Limiting fizzy drinks, as I mentioned. And also magnesium is helpful. It regulates your cortisol levels, and you can get that from Epsom bath salts, green leafy veggies, almonds, and dark chocolates as well. So this is a nice slide from the Canadian Food Guidelines, just to remind you to eat a lovely variety of whole plant foods. And as you know from what we've learned today together, this can boost your serotonin, increase your micronutrient profile, boost your tryptophan availability, reduce homocysteine levels, and remember to mix up your spices and flavors so you can get different sensations and textures. And so, yeah, I think another good tip is try not to let the food industry fool you into reaching for those junk food options by improving the amounts of different textures that you include in your day-to-day, like dipping a crunchy carrot into creamy hummus to vary the textures in your mouth. You can use flavors to your advantage, new spice mixes, miso paste, for example, hoisin. In the UK, we have something called Marmite, which is essentially a brewer's yeast extract containing vitamin B12. You can add that to soups or stews, as well as putting it onto toast. These are all great ways of increasing the flavor in our dishes without increasing the empty calorific content of our food. Another nice tip is to aim to follow the 5-ingredient rule when you're out buying foods at the shops. So, you know, if that helps you to buy something with less processing, it can be a useful tip. I do like to talk about ensuring that you have vitamin B12 supplementation, especially if you're completely plant-based. I also like to advise long-chain omega-3 fatty acids from algae or algae oil supplementation, which you can get relatively easily now instead of fish oils. It's the purest form of long-chain omega-3 fatty acids. And yes, it's a lovely way of ensuring that you have good omega-3 content, as well as having things like flax seeds, chia seeds, hemp seeds, and walnuts for your plant-based omega-3s. And I've also touched before on the importance of vitamin D, but I've just wanted to mention it here again in the supplement section. Now, I thought it would be worth mentioning, because many people talk about brain fog. Many people are concerned about the changes around menopause, for example, but also just generally as we get older, where our hormones can contribute towards what we call brain fog. And there are other ways that we can use to sort of help improve our focus and our ability to use our minds as we get older. And I thought I should touch on sleep. We really want to aim for about 7 to 10 hours of sleep a night if we can. And this is important because during sleep, the body and brain undergoes recovery and repair. It uses this time to sort of clear out toxins and metabolic waste in that self-cleaning process called autophagy. So it's definitely worth prioritizing sleep where you can. And sleep deprivation can cause cognitive impairment and also reduced function of our immune system. So it's definitely worth prioritizing sleep. Moving our bodies, as I've mentioned before, is something that we tend to neglect often. And I myself am included in that. But I really have aimed more recently over the last few years to prioritize movement. Spread it out over the week if you can. Now, our guidelines in the UK suggest that you should aim for 150 minutes a week of moderate exercise or 75 minutes of vigorous exercise. And if you can spread it out, then all the better. This can improve your learning and memory and also reduce your risk of dementia by increasing BDNF, which I mentioned earlier with regard to turmeric supplementation for period pain. Alcohol can increase our anxiety, it can impair our concentration, it can impair our sleep quality, and it increases our risk of dementia. It increases our risk of cancer. Basically, although many people enjoy alcohol, it's really not our friend, especially as we go to menopause and beyond. So if you're somebody that uses alcohol to relax and unwind of an evening, really aim to consider reducing your intake wherever you can for long-term brain health and hormone health. And again, I know that we talked about hormones in relation to menopause, herbs in relation to menopause, but it's also helpful to talk about herbs in relation to brain health as we get older, and turmeric, ashwagandha, sage, lion's mane mushroom. These are all really helpful for improving our concentration, reducing our anxiety, and hopefully also improving our insomnia as well. Right, we're nearing the end of this presentation. Thank you so much for joining me. I just want to end with a little bit of a recognition that eating is an emotional thing. We're all different, and we make unconscious food choices far more than we make conscious ones. Often the things that we choose to eat depend on what we grew up eating, what our parents ate, what our friends eat, what the easiest food is to eat. So finding motivations is really important. So just think to yourself as you watch this lecture, what it is that you're looking forward to doing with your healthy lifestyle. What are you looking forward to achieving with this healthy lifestyle? Are you looking forward to feeling anything different? Hopefully, if you can focus on these things, as well as the values that are important to you, it will help you to make more conscious decisions when it comes to the things that you're eating. And it will also help you to make some simple swaps when it comes to your daily or weekly shopping lists. And I do think that luckily, one of the easiest things that you can start with when you're thinking about lifestyle changes is the things that you put on the end of your fork. And hopefully, if you can do that, then it can make some of the other changes a little bit easier to imagine. So yeah, I think that loving the foods that love you back means that you find yourself with a little bit more love for life as well. So again, thank you so much for joining me. I'm obviously happy to stay and answer any questions that you have. If you'd like to talk to me afterwards, then please do follow me on Instagram at plantpowerdoctor, where you can message me, or you can email me via my website. And I will also just pop up here. There's a few reference slides that you might be interested to look at, so that you yourself can look at some of the studies that I talked about in today's talk. And if you wish to screenshot them, they're here, they're available. So you can dive in and hopefully look at some of these studies yourself if you are somebody that is a bit of a geek like me. Also in my book, actually, there's an awful lot of references. There are nearly 600 of all different types of conditions: heart health, cancer, immune health, gut health, plant-based eating for all ages. But it's also a very accessible book. So there's plenty of color, recipes and pictures to keep you going. So thank you so much, everybody.
Wow. Thank you so much, Dr. Newman. This was so meaningful and so thorough and just so useful for so many of us. And really want to thank you. You did share your email address and your website. Is that the best place to go and get your book for folks that want to go ahead and get that?
The best place to get my book is actually Amazon US. You can also get it, you can order it from Barnes & Noble and Target, but I would recommend probably Amazon US at this point. And it became available in March. So I'm very excited to share it with you. And I really hope that it will be helpful for those of you who are interested in a plant-based lifestyle. It's a complete why to and then how to book.
That's perfect. Thank you very, very much for that. And so we'd love to jump into some questions and answers, and just want to make sure that everybody here understands how we go about doing that. You might see that we're starting to get some raised hands. That's how we do it here at The Real Truth About Health. And so for our audience members that aren't sure how to do that, again, what we do is we typically don't take questions directly from the chat box, but we do ask you to raise your hand. And again, if you're not sure how, you have different tabs in your Zoom window. One of those tabs is called your reactions tab. If you click on your reactions tab, you'll see a bunch of different emojis pop up, and one of them says raise hand. So you'll click on that. We'll see your hand raised. We'll get to as many questions as we possibly can. And I will actually wind up calling you by your first name and unmuting you, and you'll be all set to go. So, Dr. Newman, if you're ready, we'll jump right in.
I'm ready. I'm excited.
Fantastic. Thank you. Thank you. So first up today is Deborah. Welcome, Deborah.
Hi. Yes. Good morning. Can you hear me okay?
Yeah.
Okay. Thanks for the talk. It was really informative and reaffirming, because I've kind of been on this path for a while. But I had some specific questions about the thyroid thing, and more about the food and diet along with this plant-based thing. I'm assuming like totally plant-based. I'm on HRT, the creams and stuff, all that stuff. So I had a question, like you mentioned garlic, and eat garlic, and, you know, for the zinc and all that, but is it better cooked? Is it better raw? And then I wanted to talk a little bit about like the cruciferous vegetables and food that affects you if you're on thyroid medicine. Already, because I struggle kind of with that. Like, I'm now growing my broccoli sprouts, and they say eat them raw, and I'm thinking to myself, but I know the raw broccoli is something I'm supposed to avoid, and always cook something a little because of the medicine I'm on for the hypothyroid. So some of the stuff gets a little contradictory, and I wanted to optimize my eating. And also, I've had different doctors say about how to take thyroid medicine. And like one of them said, oh, even divide it up, because the medicine has such a short half-life that if you take some of it in the morning and then a little bit in the afternoon, you'll have that more even effect between the T3, the T2s, the T this cells, all this stuff. I don't know. It all gets kind of like you don't know what you're doing anymore, and you just want to have a hamburger. I mean, not really. I'm just kidding.
No, I get it. It can feel very difficult. And I think when you have a thyroid imbalance already, you have to, as you've said, be more mindful of making sure that you aim to have your iodine blocking foods at different times to the foods that won't. So with your thyroid medication, I'm not supposed to give personalized medical advice on here, but I would suggest, if you haven't already tried it, make sure that you have your medication at different times from when you're eating. So perhaps just have it on an empty stomach at the beginning of the day. I wouldn't worry too much about the half-life issues that you have previously been worrying about, because actually the half-life of thyroid function is very long. We usually test it every 3 months to get an accurate assessment of the right dose of thyroid hormone supplementation. We can sometimes do it 6 weekly if we want to get an idea of the direction it's going in, but 12 weeks is usually what we do, because there is actually a very long half-life to the thyroid supplementation. So just aim to take it on an empty stomach, and you don't have to worry about taking it lots of times during the day. Just take the whole dose in the morning. It would be my personal opinion, but you have to discuss that with your physician. And as I mentioned in the talk, it's really about making sure that you have just enough of the components that you need to help you with your thyroid function. Now, remember, you're taking a thyroid supplement, so in some respects, you don't need to worry as much, because you're actually supplementing your thyroid hormone anyway. But I would say make sure that you have 150 micrograms of iodine daily. And if you want to reassure yourself that you're getting that, there's no harm in taking a non-seaweed based iodine supplement daily, and ensuring as well that you have enough selenium. So perhaps taking an iodine supplement with a Brazil nut each day gives you the perfect amount of iodine and selenium, and you won't really particularly need to worry about consuming your cruciferous vegetables. You don't need to worry too much about how much garlic and whether it should be cooked or raw. And to answer your question, I think I always prefer cooked garlic personally. And interestingly, generally speaking, nutrients are quite handy to have both in cooked and raw forms. Many people get great advantages from following a raw vegan diet, and that's a great thing. But it's also worth mentioning that sometimes when you're cooking certain nutrients, they are more bioavailable. So, for example, lycopene and lutein are phytonutrients that are more bioavailable once you've cooked them. And the same with things like soaking and sprouting. These are really important things that you can do to increase the bioavailability of the nutrients within your grains and within, your plants. So I hope that's helpful. I suppose really the main thing I want to perhaps leave you with is to try and make things a bit simpler for you, trying to help you to relax a little bit around these food choices, and just take your thyroid medication early in the morning before you start eating, and then monitor your thyroid function every 3 months to give you an idea of where things are going.
Thank you very, very much for that, Dr. Newman. And I'm going to go ahead now to Dominique. Welcome, Dominique.
Hi, doctor. Thank you for having me. So I'm 57 years old. I've been menopaused for 6 years now. It went flyingly. It took like 4 months, almost no heat flash and everything, and it was really great. I've been plant-based for 4 years and SOS free or low for a year, so I'm doing that good. My concern actually is about sleep. I've never been a person who sleeps a lot. I really try. When I go to bed before midnight, I wake up at 2 and I can't sleep anymore. So I'm a high energy person, but I've been getting brain fog a little bit, like memory lapses, and so I'm a little bit concerned about that, and I can't sleep. So I don't know, maybe I have too many ideas in my head, but I don't know. Do you have any tricks, any hacks to fall asleep or something? Or do you think that 6 hours of sleep is good enough? Or because I've been going along 6 hours of sleep for most of my life.
Yeah. Thank you for your question. And it sounds as though you're struggling a little bit because, you've said that you are hoping to get more sleep and that you're having brain fog and issues during the day. And that when you go to bed before midnight, you wake up at 2 a.m, which is obviously not ideal. I think that many people sort of survive on less than 7 hours of sleep, but that doesn't necessarily make it optimal. Worrying about sleep is also in itself a bit of a problem. And I would love for people, so there's two types of person. There's the type of person who doesn't think about sleep and doesn't prioritize it and then doesn't get enough. And it's quite simple and straightforward for those people. If they can know that sleep is important, they might prioritize it, go to bed earlier, get more sleep. But there's another group of people that really suffer from being unable to sleep. And the advice is slightly different when you have insomnia, because you've probably done all sorts of things in the past to actually improve your sleep patterns. You may have had like lavender on your pillow, or, a hot drink before you go to bed, or a hot bath. There's so many things that people try and they think that it's going to help them sleep, and they get into certain routines that they think are going to help, and then they get worked up that it's not working, and it can lead to then quite a negative cycle. So I think probably the number one thing that I'd like you to take away from this question from me is actually to really focus on making sure that you get up at the same time every day. So don't try to lie in the morning. If you woke up at 2 a.m, then 3 a.m. or 4, don't try and lie in to catch up on the sleep. There's actually a really important technique, which is a type of cognitive behavioral therapy technique for people who suffer from insomnia, where you do have to almost reset your sleeping patterns by sort of forcing yourself into periods of wakefulness. And the main thing I'd say is focus on getting up at the same time every single day, regardless of how little sleep you had the night before. Don't force yourself to go to bed early. Only go to bed when you're feeling tired. I think that's a really important tip. Many people get really anxious because they know that sleep's important. So they'll aim to go to bed at 9 or 9:30 or 10, and then be worried that because they're not going to bed that they're losing out. So try to only go to bed when you're actually feeling tired, and make sure that you wake up with an alarm, if necessary, at exactly the same time every single morning. Now, even if that means that you don't go to bed till 1 or 2 in the morning when you start out on this particular sort of technique, you'll hopefully over the course of a few days or weeks find your rhythm, which will allow you to go to bed when tired, which would be a reasonable time, and continue to wake up at the same time each day. Another tip would be to ensure that you get early morning daylight exposure. So when you get up at this said time that you've given yourself, immediately within half an hour of that, go outside. Go outside wherever you live. You don't have to have a garden. Just leave the house and look up into the sky. Even if it's raining, even if the weather isn't great, if you look up into the sky, the photons of light will be received by the retina, the back of your eye, and it will help you to stimulate serotonin in the body, which 12 hours later will turn into melatonin, some of it at least. And that melatonin will be a useful sleep aid because it will allow you then to start to feel more sleepy at the time of day at which it's appropriate to fall asleep. You may also then benefit from reducing your blue light exposure later on in the day. So if you're having to use screens, you could use blue light blocking glasses, for example. You could use low light around the house, lamp light, red light, avoid stark overhead lighting. And I think that's probably enough to be getting on with. There's a few more things I could say, but I don't want to be talking all day. I could give you a whole lecture on sleep, but I think the main things to take home are same time waking up each day, only go to bed when you're actually feeling tired, early morning sunlight exposure, avoiding caffeine after midday. And if these things are not helping you, then seek out an insomnia CBT course.
Thank you very, very much for that, Dr. Newman. And we shall move on now to Crystal. Welcome, Crystal.
Hello, how are you?
I am very well, Crystal. How are you?
I am well, thank you. I think you are brilliant. Thank you for all of this phenomenal information that you presented today. You are just simply awesome. This is priceless. I appreciate you.
I appreciate you. Thank you.
Okay, well, thank you. I have two quick questions. One concerning fibroids and the other one concerning bioidentical hormones. So with the fibroids, if you have fibroids, I was told just by chance that I had fibroids many years ago, but they've never bothered me. I've never had any issues. When I did have my menses, I never had heavy periods or pain or anything like that. It was like a piece of cakewalk. But fast forward, now that I'm older, I'm wondering if there are any foods that I can eliminate that would help get rid of the fibroids, or do I just, if they're not bothering me, don't worry about it? I'm just trying to figure out if there are things that I can put in place to maybe get rid of them. I don't know if they ever turn cancerous later on or whatever. I don't really know. So that's question one. And then question two had to do with the bioidentical hormones. I am postmenopausal, but I never had any symptoms, no hot flashes or anything like that. I keep waiting to see if they're coming. And so I'm in my 60s now, and my friends are saying, if you haven't gotten hot flashes now, you're probably not going to get them. So, but I am concerned about heart health and bone health because I do have osteoporosis. So if there's anything that you can recommend along those lines, that would also be helpful. I am plant-based. I try to incorporate tofu and edamame when I can, but I don't eat it every day. But I eat loads of beans and salads every day, and I make my own salad dressing. And
sounds great. Sounds great. You're doing amazingly. And well done. I think, you're obviously really taking charge of your health. That's great. So there was a lot to think about in what you said. And again, without giving out personalized medical advice, I would say to you that given that you're in your 60s, I don't think you particularly need to worry about shrinking your fibroids actively, because the chances are They may have already shrunk themselves, given the fact that you've already gone through menopause. I don't know if you've recently had an ultrasound. I don't know what size they were originally, whether there's a way of comparing the size that they are now to the size that they were when you were diagnosed. But for many women, they do begin to shrink after menopause anyway. And you don't need to worry about them becoming cancerous. It's just not something that tends to happen. Many women are sort of fearful when they're diagnosed with fibroids that it's a form of cancer. It's not, and it's not likely to proceed in any way towards cancer. So that's great. I understand your concern about heart health and bone health. Now, obviously, you're eating a healthy plant-based diet, so you're doing all the things that you can to improve your heart health. Bone health wise, I think it's important to make sure that you go for good amounts of calcium and vitamin D, and also weight-bearing exercise to help improve your bone strength. And as I mentioned before, soy is great for that too. So if there's a way for you to incorporate soy products daily, then perhaps you could do that. Weight-bearing exercise, and also resistance training. So I know that many people in their 60s are not particularly confident with the idea of the gym. I don't belong to a gym, but I do think that especially as we reach later years, we're going to have to really focus on maintaining muscle mass. And vitamin D helps us to maintain muscle mass, and so does resistance training. So you could even use your own body weight, simple Pilates or yoga, or even just getting cans of beans or whatever you've got in your kitchen and lifting them. Things like this will actually be helpful for improving bone mineral density and muscle mass as you get older. The question around hormones and HRT, I suspect that given that you went through menopause, it sounds like more than 10 years ago, the window of opportunity for improving your bone mineral density has likely already passed when it comes to taking HRT supplementation. Osteoporosis guidelines suggest starting it around the time of menopause if that's what you're aiming to do. So the bone mineral density loss that you have experienced around menopause has already occurred. And given that you don't have any other symptoms or problems, it may be that HRT is not something that you particularly need to concern yourself with at this stage, given that you're having a healthy plant-based diet. But you can discuss this with your own doctor, who can perhaps do some separate research into whether there are any potential advantages for your heart or bone health moving forward, given your age and general healthy lifestyle.
Thanks very, very much for this, Dr. Newman. And let's bring in Ruth now. Welcome, Ruth.
All right, Ruth. Oh, hi.
Hi, Ruth.
Hi. I'm sorry. I tuned in very late. I'm going to have to re-listen to your whole talk, but I just turned it on about 5 minutes ago, and I don't know if you can answer these questions that I didn't get answered last night. With regard to soaking beans, when it comes to buying beans in the cans, like their BPA-free cans, do we have to soak those beans?
No, they're usually pre-cooked. So you'd probably just want to rinse those. You can rinse those. Maybe it's helpful to rinse them because it can reduce bloating. So yeah, just rinse them and I think you're good to go.
Excellent. Thank you so much for that. And now we're going to bring in Ainsley. Welcome, Ainsley. Oh no, Ainsley, we're having our volume issue again. Are you able to get right to that? Ainsley, so we're not hearing you, but I know you can find a way to fix that. So I'll call on you in another few minutes if we can. And so let's now go to Mike. Hang on, Mike. Hi, Mike. Welcome.
Well, thank you, Ben. Thank you, Ben. And Dr. Newman, thank you very much for this talk. I was hoping to get a little bit of advice. I have a holistic doctor that I use, and I resist taking any medications. The one medication that she would like me to be on would be the NP Thyroid. And that's basically only because my TSH is a little bit elevated, 5.79. All of my other markers are good. My free T3, my others, I track things very well. So I hesitate to take the MP thyroid because I used to, as well as the Levoxirin. And the only thing that really benefited was my TSH came down. Now, it would be remiss for me not to mention, I do have some of the Hashimoto's. It's moderate at 175 for the TPO and a 6.7 for the thyroid globulin. So I feel like I'm fretting and chasing, trying to get the TSH and my Hashimoto's really low. I take no other medications. I'm plant-based. I'm healthy. I don't have any of the Hashimoto's symptoms per se. So I'm chasing a number. My doctor's chasing a number that I don't know that I should be hyper vigilant on these things. So I'm just hoping to get a little bit of advice. And one last note, I was hoping that if you had a way to let me change my text synthesis for your voice, because it's very sexy, I would be interested in having that module.
Okay. Well, thanks for that. I think it's difficult for me to give you advice on your own personal medical history, but I think if you're generally well and you're not experiencing any thyroid symptoms, then it's essentially your call. It's always going to be your call. A doctor can only ever give advice based on the scientific literature. And it sounds as though your doctor thinks that it would be helpful for you to take a little bit of supplementation. I guess one way to find out whether it's helpful or not is to try it and see how you feel and check your blood markers and then see if you notice any changes to your overall energy, your mood, the temperature that you're feeling, whether you're suffering from any hair loss or whether you notice any changes with regard to your weight. And then you can make an informed decision.
I'm so sorry. I muted myself. Thank you very much for that, doctor. And
that's all right. It's easily done. I do it to myself all the time.
Oh my gosh. Self-sabotage. Let's now go to Chris. Welcome, Chris.
Hi, doctor. Thank you so much for all your very sage advice. I have tested going on Hashimoto's again. I test positive for Hashimoto's, and I've been borderline hypothyroid. They've been following it for 20 years. I'm not on any medication, but I was wondering if there's any hints or any advice you can give for the plant-based approach that can get rid of it. Is there any way, whereas once you have it, you always have it, or is there any way that those levels can go down so you no longer have it? I know they said it's kind of like an inherited thing, but I don't know what advice you might have. If there's a possibility, have you ever seen people who have tested positive for the Hashimoto's to have it disappear?
So yes, you can definitely monitor it, and you can find people who have symptoms and signs and raised TPO, and then over time and with lifestyle changes, those things can be improved. TPO levels can go down, symptoms can be improved, or even reversed sometimes. But I think my general advice would be the same as what I've said in the talk already when it comes to lifestyle, is optimizing the things that you can control. And that's all that you can really do. So having a diet that's rich in all the things that are going to keep you healthy, fruits, veggies, whole grains, legumes, the soy products that I mentioned are helpful. But when it comes to thyroid health, you do have to be aware to make sure you have enough iodine, enough selenium, enough zinc, enough iron and all the other nutrients that we talked about, making sure that you move your body, making sure that you prioritize sleep, making sure that you reduce stress in your life, and also making sure not to stress out too much over all the lifestyle changes, because it's important not to be too hard on yourself. I think often excess stress can itself be detrimental to overall health. So find things that you enjoy doing, focus your time and energy on healthy foods, but also healthy connections with other people. Aim to make social plans that make you feel good. If you're feeling overwhelmed, or that things are not as you would like them to be in your life, then maybe just take stock of that and make some changes. And once you have done that and you're feeling good, check your levels and just do the best that you can. You may find that you will need to have thyroid supplementation, and that's okay. Most important thing is to just do all the things that you can control and let go of all of the rest.
Thank you so much for that, Dr. Newman. And let's try Ainsley again. Hang on, Ainsley. Hi, Ainsley.
Hi, morning, everyone. Morning, doctor. You all are hearing me now?
We are. Thank you.
Yes, hearing you. Morning.
Good. Ainsley from Trinidad. Question, doctor. You said in your slide, unprocessed soy. I need a little clarification on that. Unprocessed soy. You also spoke about turmeric, but isn't saffron threads king versus the turmeric because of that bright orange golden pigments we get? And oh gosh, I can't remember the other question. Just those two. The unprocessed soy, I'm a little lost on that. Is it the soya bean you're talking about to avoid? And is saffron threads king?
Okay, so basically a minimally processed soy means so unprocessed soy would be the maybe the edamame bean, and then minimally processed soy would be tempeh, for example, and things like miso paste, which is fermented soybeans, are great. And soy milk, depending on which brand you go for, is another minimally processed soy option. When a lot of people have soy in a more processed form when it comes to replacement meat products, and that's what I'm talking about, the difference between. Not to demonize replacement meat products, they have a place and many people enjoy them, but they are more processed and therefore they will have some less of some of the health benefits than minimally processed soy, which would be, as I said before, things like tempeh or tofu. And unprocessed would be things like the edamame bean itself. And yeah, that's about it. And when it comes to saffron, yes, that would be a wonderfully beneficial thing to include in your diet. It's quite expensive and difficult to get hold of for a lot of people. So I tend not to include it in my slide deck, but it's a great thing and I would encourage you to enjoy it. And turmeric, I'm not sure if I heard you correctly. You were asking me about the difference perhaps between curcumin and turmeric. I'm not sure, but the curcumin is one of the active compounds within turmeric, which has been studied in many trials and shown to have therapeutic benefits. But I think I would personally suggest using turmeric because there are probably lots of compounds within it that we haven't studied that also have synergistic effects and can improve health.
Thanks very, very much for that, Dr. Newman. And let's go now to Alejandro. Welcome.
Hi, Dr. Newman. Thank you for your time with us. And also, I find your way of talking quite soothing. Also, I really appreciate the way that you answer questions, and that's really, really cool to see. My first question is, do you have any information or something that you could expand further on the use of zinc, vitamin D, quercetin, in protecting the immune system against spike proteins?
Yes. So there have been studies to show that zinc is particularly useful for that purpose. And vitamin D, again, yes, there have been studies to show that that's been very helpful for reducing potential problems with COVID. What else? I think I read about quercetin, which is from things like onions and garlic being useful as well. Coenzyme Q10 has been shown potentially to be therapeutically useful. So there's a few things that could be helpful. It would be nice to have a bit more data, but I'd say a general healthy lifestyle is always good to support the immune system. And sleep, again, I don't know if I touched on this in the talk, but our natural killer cells can can start to grow and multiply during sleep. And that's why when we're ill, we tend to want to sleep more. But yeah, do not underestimate the power of sleep to help the immune system as well, especially if you're feeling a little bit under the weather.
Thank you, Dr. Newman. And really, thank you very much. Folks, we are up against the clock for our next lecture. And yeah, that just flew by. We must be having fun. I want to thank everybody for raising your hands. And I'm sorry we couldn't get to every question. But obviously, we're just so grateful to you for being here and for a very thorough, very meaningful presentation for so many. I know I am not the only one that wants to thank you. So we're going to have our tech team unmute our entire audience. Everybody, what would you like to say to Dr. Gemma Newman?
Thank you
You
very
are
much,
absolutely
Dr.
awesome.
Very much.
Thank you very much.
Awesome.